James Farr here, live from Pasadena Media Studios. Get ready for more piercing and provocative. The Conversation Live starts now. And welcome to another episode of The Conversation Live. The Conversation Live focuses on social justice, restorative justice, inclusion, and equality. It's May, folks, and May is Mental Health Awareness Month, and we're going to have a very critical and uncomfortable conversation. Joining me today is Heather Wall as well as Sarah Panea, and both are licensed marriage and family therapists. We're going to talk a lot about trauma, informed trauma care, as well as some of the cultural isms as why people of color typically don't go to seek therapeutic services. But for context, we know a lot of that trauma starts well into a human's childhood. So let's roll in this first clip for context, and I'll be right back with my guests.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or pathogen chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence.
And welcome back, Heather, Sarah. Thank you so much for taking time out of your schedules. I hope you're not missing any time with clients right now.
A little bit. This is worth it,
Just
you know?
Just a little bit.
Yeah.
I mean, we're dealing with a very serious subject here. And I really appreciate you guys taking the time. And Heather, you have such an amazing story. I mean, both of you work in the industry. You're both clinicians. You service people. That's what you do for a living. You help people navigate a pathway. But Heather, you actually came today, not as a therapist, you came to share your story, your personal story, about your journey to mental health wellness, and as well as some of the other things. So trauma, you had a little bit of trauma in your early childhood. Can you share a little bit?
Yeah, I did. Actually, I had trauma at the age of around 6. And it was from someone that I trusted very much, and I was molested. So what that did is it really kind of turned the table about what I felt. I mean, I felt incredible amounts of fear. I mean, from that moment, it sort of escalated into, you know, we haven't really talked about what I want to share as my diagnosis. Should I put it out there?
Put it out there.
Okay.
Yeah, I was going to let you do that.
Yeah, I'll give you the whole story. So
Okay.
at 6 years old, since I had the severe trauma, what it did is it kind of activated part of my brain that I started hearing voices. And I was very young, and I couldn't make sense of it. And I remember telling my mom, I'm hearing something in my head. And she just was like, oh, honey, what's his voice sound like? And she wanted to know more about it. But as time went on, it escalated. So from that trauma, it sort of just unfolded this ongoing life struggle with finally getting diagnosed at a later age of schizoaffective disorder.
Okay. I mean, we definitely will jump into the schizoaffective disorder.
Yeah.
I want to go back to that little girl, though.
Yeah,
So
yeah.
she's 6 years old. She's been violated.
Yeah.
She's experiencing some trauma. Were the people in your circle, your family, I mean, was your mom, your family members like, that's just your imagination? I mean, like, How does that exist where this little girl is crying out
Yeah.
and sharing something traumatic?
It became more of it was a secret that I had to keep. So that being what it wasn't something that I could talk about with anyone. I didn't feel that. And it sort of manifested the way it did in the fear and like being scared to go to school, turning bright red when I got called on in class, like just being scared about meeting people, being scared to just be in the world.
Sarah, what is someone experiencing when they're kind of like what Heather is describing clinically when you're looking at them, when you're talking to them? Because again, folks, we want to normalize therapy. We want to normalize psychological services so that, you know, and eliminate the stigma. But what is this little girl thinking? And as you're seeing it through the lens of a therapist.
As she's sharing, it is common experience that when there's sexual abuse in the home, it's kind of a hush-hush, a taboo topic, and a lot of times children are told to not talk about it. And so, as we know, unresolved trauma creates a lifetime of difficulties, which we normally see that they turn into mental health issues later on in life. So that's what we see, unfortunately, because the child is not allowed to process that trauma.
So now you're getting older. You're adolescent. How is it showing up there? Because there's a long, not a long one, you're not old, but
Thank you.
we got a little bit of runway to get through.
Yeah, we do. Yeah.
So how did it show up, you know, in adolescence?
Adolescence, it was a lot about trying to fit in, feeling different, feeling not part of. And what ended up happening is I reached out at a very young age, like 12 years old, to drugs and alcohol. I felt an emptiness. I felt not connected to people. I felt very different. And I think that drugs and alcohol sort of filled that void or that emptiness that I was feeling. And it kind of gave me and boosted up my so-called, what I thought it was, my ability to be in the world, you know, to show up.
So you were coping and kind of masking and self-medicating.
There you go.
Now, is there a history in your family of substance abuse or addiction? I mean, were you genetically pre-exposed to?
Yes, I have that in my family, and it's interesting because not only do I have addiction run through my family, I know from my mom's side and my dad's side, not only that, but trauma, repeated, you know, abuse, and also having, the addiction portion, but also having, just having that abuse factor. So that running into not having that secret was really kind of what led me down that path.
So Sarah, when someone is self-medicating, I mean, how is the brain processing? Why are they choosing, a substance? Or I mean, it could be food, it could be cutting themselves. Like, why does it show up this way? Because this is trauma.
And as she's sharing, as a child, the child's bio composition actually changes. The brain changes. It's wired. The amygdala is triggered. The amygdala is our alert system, and sometimes kids, when they have the trauma they've experienced, sometimes it's complex trauma. They have different things going on: substance abuse in the home, domestic violence. I'm not saying that's your case. Mm-hmm. However, the actual wiring of the brain is different. Mm-hmm. So we do know that in children that haven't processed that trauma, I don't know if that was your case, mm-hmm. This unresolved trauma ends up in a higher incidence of depression, anxiety. Substance abuse is also, once again, a symptom of what's happened and what's occurred because the child wasn't, in this case, what she's sharing, didn't never process the trauma. So
is the use of substances or alcohol or any kind of other addictive disorder, is that part of that? Are you freezing? Or are they fight, flight, or freeze, kind of going reptilian? I'm trying to understand where you're centered in that part of the process. Right, so the person gets stuck in that, once again, that alarm system, the flight, fight, or freeze. Then the person learns how to actually navigate their world stuck in that flight or fight.
And so a lot of times we see self-medicating because there's also that mental health component. She was talking about hearing voices. And sometimes people will take uppers or downers depending on what the mental health issue is. So that's common when trauma has affected a child.
What were some of the substances, if you don't mind sharing?
Sharing all
Yeah.
of what I started. What I started with is interesting. Was alcohol and weed, and then it became opiates. So landing into finding what felt like it was serving me, or like really treating what I was feeling, which was anxiety. I really leaned into the opiates, and alcohol was always there, and it escalates with addiction. It just keeps going. So it just went up the ladder. It went all the way up to heroin and meth.
And I want to talk a little bit more about that. Let me check in. You're watching The Conversation Live. The Conversation Live focuses on social justice, restorative justice, inclusion, and equality. We're having a conversation today. It's May, it's Mental Health Awareness Month. We really want to unpack stories and really normalize mental health and, encourage people that you're not crazy, and some of the other euphemisms you may hear. It's that there is help and services available for you. And today I have Heather Wall and Sarah Pineda, and they are both licensed marriage and family therapists. But Heather is sharing with us today her lens as someone with a diagnosis, someone who has had to recover from some things. And we're talking about some of the trauma in her life. We're kind of right now up in the teenage years, adolescence, going on. So somewhere between adolescence and your adult life, you became a therapist.
Yes, I did.
Okay.
I managed that, believe it or not. It's really kind of fascinating when I think back, but that's the ability to function as faking it, Yeah.
I mean, you shared some things with me and how we've met, and so we'll may share some of those things later, visuals and whatnot. But how low did low get for you? What was the bottom?
It's a loaded question. Being in an apartment all by myself, hearing voices, thinking that the FBI, the CIA, and my family all wanted to kill me. Telling people that I had a gun walking the streets, relentlessly searching for drugs, and just trying to manage my way out of that, there was no end, and getting suicidal. That's where it dead ends. And you hopefully make it past that.
Did you attempt suicide?
I ended up getting 5150'd. Yeah.
And was that experience, how did that impact you?
That was a moment in time where, to give paint a picture of that, is that's where I got my firm diagnosis of what was really going on. It wasn't just anxiety, depression. It wasn't just bipolar disorder. It was a mixture of the schizophrenia symptoms and the bipolar disorder that kind of met in the middle. And the drugs only aggravated that. It only made it worse. So
So it didn't kind of level you out or anything?
After a while, it's very interesting, and I find this because I work in drug treatment. It's just that you can use something for so long, and then eventually it stops working. It stops being a solution. It stops being the thing that's working for you, and then it sort of backfires on you. So you haven't learned any coping skills. You haven't learned anything new. So that's where I landed. I was just going down like a hamster. I was just like running, thinking this is the answer, because I didn't know any other way.
Okay, so Sarah, with her diagnosis kind of being a hybrid of schizophrenia and bipolar, what does that actually mean? For us, real bite-sized pieces,
right, so
we can understand.
So schizoaffective disorder is, as she mentioned, there's two sides to that, and a lot of people get misdiagnosed. They either are diagnosed as bipolar or schizophrenic, and this is a combination of the two. We have the depression and mania, happening, and then we also have the psychotic features, the hearing of voices, hallucinations, delusions. And so when you combine that, this is a diagnosis that actually very few people have. It's like 0.3% of people that actually suffer this diagnosis. And so as clinicians, we have to be really careful and see the person's history to be able to come to the diagnosis. A diagnosis is so important because obviously the treatment will follow. And if we are not really hounding in on what's happening to the client, we're not providing the appropriate treatment.
Did you have any experience with that, kind of being misdiagnosed?
Yeah, it was, see, by the time I finally was seeking help, I was to the point where I thought, wow, I have a major drug problem. Like family was like, well, something's up, you know, and I'd end up in ERs and I'd be seeing things and hearing things, but they'd think it's just a drug use. So it kind of like, it gets confusing for the diagnosis. But I think that landing into a diagnosis of bipolar, first it was anxiety, then it's bipolar, and then it became schizoaffective as my psychiatrist sort of watched it unfold in front of her. You know, having that long-term relationship with someone so they can actually see what's really going on. It's really crucial.
Let me check in real quick. You're watching The Conversation Live. The Conversation Live focuses on social justice, restorative justice, inclusion, and equality. We're having a conversation about mental health and mental health awareness. Heather Wall and Sarah Pinea are my guests today. They are both licensed marriage and family therapists. Heather's sharing a very personal story, triumphant story. Sarah's here as our resident expert, so but you guys both work in this space. This is what you do all day, every day, and I imagine even when you're not at work.
Right.
My wife had a friend, shout out to Rose, who's a therapist, who I would tell her, don't be therapying me, and I don't even know if that's a real word, right? Like she said, how you feeling, and all this other stuff. But I mean, when we talk about cultural norms, you know, and isms, and you know, and I really want to. This may get a little uncomfortable, but I want to look at it through the lens of people of color and access. Because Heather, we met on a project kind of addressing inequalities in healthcare. You know, you had access to healthcare. You had access to treatment centers.
That's right.
But Sarah, you may kind of see it through a lens where culturally there's a barrier, access, cost,
Right.
insurance. So how do we, you know, how do we kind of break that barrier first? Like, you know, how do we normalize this process? I mean, it's, you guys are both comfortable talking about the subject because that's what you do. So how do we normalize it for people of color in the community? Where's that conversation?
Well, this is a
start?
great start. You know, just having the conversation, putting the issues on the table, and having those candid conversations. You know, a lot of people of color, Black, brown, we have difficulty just with the mere idea of going to a counselor or a therapist. It's seen as, you know, I'm not crazy. I don't need that. I can deal with my, you know, there's a saying in Spanish, you know, lavo mi ropa en la casa, meaning I wash my own laundry at home. So I take care of my business at home. And so there is that stigma, and surpassing that stigma is difficult.
What about just go to church?
Well,
Pray on it.
some people do bring that, and we do incorporate that in therapy. You know, if that's something that is going to be a strength for that client, we actually incorporate that and say, wow, you know, I'm glad that you're doing this. However, maybe we should work on these different things that you might be able to do to cope differently. So it's not we don't discard the fact that somebody might say that, but we incorporate it in their treatment. So because it is a strength. They're accessing community resources, so that's something that we actually do celebrate and bring into the treatment.
Because in your practice, you serve a large population of people of color.
Absolutely.
And so that's kind of to debunk the myth that people of color don't go to therapy or aren't seeking services. And in your space, Heather, you know, working at a treatment center, I mean, you have a different lens. That you kind of different. I mean, you were raised in a different part of the country. You're here in, you know, Los Angeles or the Los Angeles area. I'm sure you've gotten what do you know, white girl, about hardship?
Oh boy. What do I know? Well, probably not a whole lot, but I do know that I have suffered, right? And I know that what I've been through can hopefully help people see that there is a way out. And there's places that there are resources, there are places people can go. They're limited, but I found that, you know, there needs to be more. There needs to be more resources for people.
And how do you think your own personal experience, your own life story, your journey helps you kind of when you're in, because I understand, I did some snooping, because I know someone you work with, that you run the groups Like you are everything to everybody there. And the 8 months that we've hung out, I mean, you're just a ball of energy. So,
I'm super happy to be alive.
so I mean,
you
but
know.
how does your experience, you know, has that shaped and prepared you to do the work that you're doing?
It is like to have a moment that everything that I've struggled with makes sense, and that everything I've been through is for a purpose greater than myself. That is what keeps me going. I mean, it's working with the women and working with people in recovery and with mental illness. That's why I got my license when I was sick. Why was I able to pass my exam when I was really sick?
That's what I really want.
Like
How did, because I remember we
you
started
know?
out, we said adolescence and somewhere between,
Yeah.
now you became a therapist.
did.
That's a lot of focus, a discipline.
And let me tell you, when you have a drug addiction as strong as I had one, and something to hide, it's the power of one not wanting people to find you out. So if I stay behind education, no one will look at me. I won't be noticed if I get an education.
Wow.
You know, so the things we'll do.
Why'd you get into the business, Sarah?
Why did I get into the business? I actually got into the business because I lived in a very impoverished, marginalized community, and I saw a lot of disparity in my community. Definitely conversations like this never really happened amongst the people that I knew. So I decided early on that I wanted to make a difference and go back to my community and make a difference somehow. I didn't know exactly how, but once I tapped into the humanistic and the part of the connection with other people and learned that maybe I can make a living out of this, I decided that that's the course that I would take.
Well, I can say, you know, I've been around both of you in very personal spaces,
Yes.
and I don't know if there are two women who love life as much as you guys do. You know, we got to get a moniker for you, Heather. You got Super Sarah.
Yeah, I need something.
We got.
I need something.
We'll work on
Okay,
that.
we'll
We
work
got
on
to
that.
get a handle for you. You're watching The Conversation Live. The Conversation Live focuses on social justice, restorative justice, inclusion, and equality. Ladies, it goes by real fast. We just have maybe about 4 more minutes before we got to get ready to get out of here. Why should people get help, Heather?
You know, people, to reach out for help is, I found that the importance for me was that feeling a connectedness to other people, feeling like somebody will possibly understand me by just accepting me and having empathy and having compassion. Like, I don't think people necessarily need, you know, they need to reach for help so they can reduce their symptoms, get back to a life that's manageable, is their best life, and hopefully lean towards wellness. You know?
Sarah, why should people get help?
I think people should get help, kind of echoing what she's saying, reducing the symptoms, getting tools that they can actually use to cope with the world, their world, also to empower themselves and find some sense of control. Once you know what your diagnosis is or what you're struggling with, it's a sense of relief. Not knowing is difficult. It's kind of like battling a monster that you don't know. Once you kind of know what's ailing you and what's hindering you from being the best self, it gives you that empowerment, that sense of control that things will be okay, and then the resiliency that you have, that everyone has. Tapping into that power that you have within yourself is very helpful, and definitely a counselor, a therapist can help you and nudge you a little bit to kind of find that best self.
So for the audience, for the public, in this comment, I had a debate with someone, and we were trying to understand, and it's not to be politically correct, but I mean, should we be saying mental health illness, or is there a kind of a new way of looking at wellness? I mean, so which is there an appropriate way to speak affirmatively about it? You know, because not saying that it's in vogue, but you know, there seems to be an uptick of people, hey, I'm in therapy, right? And some people may not know how to receive it. Like, are you sick? You know, like, what does that mean? You know, like, grab your purse? I mean, like, like where are we now in terms of, as an industry, what are you guys talking about amongst therapists? Is it wellness or?
I think it kind of goes hand in hand. We say illness because it is something that's hindering you from doing certain things and evolving in your world as you would like to. But at the same time, we also talk about the wellness part of it because that's what the key factor, taking care of self and doing that type of thing. But in order for us to normalize, I feel, we need to say illness and recognize it for what it is. That's my opinion, my personal opinion. Just like we say, I have diabetes, I have this, I have, a heart problem, and it becomes kind of like a conversation. Okay, you have diabetes, okay. How do you manage that? And
but it seems like the conversation then becomes positive in terms of how to treat.
Right, and I think the more we say, mental health illness, this is what I'm ailing, what's ailing me, and you have that conversation amongst yourselves or peers or just people without that flinch, like what's going on with you, some people think this is weird, I don't know how to receive it, but I think the more we normalize it ourselves as providers or as struggling with something, I think people will start receiving it better.
Okay, we got to park it right there because we were hard up on the time. Heather Wall, Sara Panaya, thank you for joining me today. Also, folks, on May 17th, 18th, May 18th is Pasadena Mental Health Awareness Day. It's at the Central Library. It starts at 10 a.m. We'll put some more information up in the post up under. Until we have another opportunity to speak with you, thank you for watching Conversation Live. As always, Agape. That went fast.
It did.
The Conversation Live is brought to you by